On a black background, a title in white appears. Audio description: Vaginal delivery table setup. An OB tech's perspective. Sandra Manwiller, voice actor and certified surgical technologist. Hi, my name is Sandra Manwiller. I'm a brown-skinned Latina cis woman with shoulder-length brownish-gray hair that's pulled back into a bun today, and I wear glasses. I'm a voiceover artist, and I'm currently filming this video in my booth. I have my laptop open, and my black microphone on a scissor arm extension hangs near my face, and my booth is lit so that you can see my face. My background curtain is of a light gold color. When I'm not behind my microphone, I'm a certified surgical technologist who works on the labor and delivery floor at a local hospital. But you may be more familiar with the job term operating room technician. Let me be very clear. I am not a registered nurse, and while we take many of the same courses in college, surgical technologists do not do assessments or administer medications to patients. As an OB tech, my role is part administrative and part surgical, and I've worked within this unique blend for more than 20 years. In this video, I will discuss what instruments and supplies are included on a vaginal delivery table. Pregnancy and childbirth can be a very exciting but anxiety-producing time, and I hope to alleviate some of your stress or perhaps your curiosity by showing you a table setup. Please note that state laws and hospital policies dictate healthcare provider practice and hospital procedures. My job role doesn't exist in all hospitals, and sometimes it's the nurses who set up their own vaginal delivery tables. The setup in this video may vary from hospital to hospital. Please do not use this video as how to do your own vaginal delivery. You should be under the care of a licensed and qualified doctor or midwife during your entire pregnancy for optimal outcomes. The experiences and opinions that I share in this video are my own. White letters on a black background appear. Vaginal delivery table.
I'm now standing in the hospital office of our lactation consultant. The walls are baby blue and tan, and there's a lot of beautiful and colorful artwork of lactating mothers. I'm wearing my navy blue scrubs, and my hair is loose about my shoulders, clipped with barrettes. To begin, let's talk about the vaginal delivery table itself. The table shown here in front of me is of a light tan laminate material, and it's about 35 inches high, and it rolls on 4 casters that lock in place. The fixed tabletop is 24 inches wide, but can be expanded to an additional 15 inches when the table sides are flipped up. It has one pull-out drawer and below a set of cupboard-style drawers for extra supplies and materials. They come in many different styles, but the important thing here is that they include some sort of a table extension and that it can be easily wiped off with multiple cleaning products. Now we're going to head back to my voiceover studio and finish the rest of the video there.
A title in white on a black background. Gowns and drapes. When the patient is ready to deliver, the physician or midwife will gown and glove themselves from the sterile table setup. They put on sterile gloves and wear fluid-resistant gowns. And I happen to have an example of a light blue, neatly folded, clean gown in my hand. And of course, as with everything, gowns and glove sizes vary depending on the person. Physicians will use these lightweight blue paper drapes that come in our sterile vaginal delivery packs to cover the patient's legs and abdomen. To help the doctor, the manufacturer even writes the body part to be covered so that there's no guessing. And a drape is also dropped on the floor to control fluid loss. Because, honey, giving birth is a messy business. I also wanted to show you the impervious drape that covers our vaginal delivery table, and it serves as a tablecloth. And everything gets placed on top of this, and it's fairly thick so it doesn't rip or tear. Typically, the healthcare provider also will use something called the under the buttocks drape, and it has a transparent pouch to catch blood and fluid. There's an example of it on screen because I just didn't have it on hand to show you. The material is shiny and slippery. It is also cuffed so that the doctor can easily slip it underneath the patient's bottom, and the transparent pouch falls towards the floor. And it's also graduated so that the nurse and the doctor can monitor the blood loss, which is extremely important. On a black background, a title in white appears: bulb syringe. An image of a light blue baby's bulb syringe lies on top of a blue surgical towel. Okay, it's time to have a baby. So one of the first actions that occurs once the baby's delivered is suctioning the baby's nose and mouth. And I have an example right here of a light blue bulb syringe. The bulbous portion, which is the part that provides the suction when it's squeezed, is rubberized, and it has ridges that encircle around it, and it probably weighs about 2 ounces. The tip is long and tapered and goes to the bottom, and that's the part that goes into the baby's mouth or nose to extract any fluids. The words cord clamp appear in white on a black background. A photo of Sandra's brown hand shows her holding an unclamped yellow plastic cord clamp. The cord clamp stops the blood flow and serves to separate the baby from the placenta. And once it's clamped, this yellow plastic clamp lies close to the baby's tummy. It's about 1/2 inch long and fits squarely in the palm of your hand. The open ends always remind me of an alligator's mouth, and when the two ends come together, it locks the clamp shut. At about the 24 to 48 hour mark after birth, the nurses use a special pair of cutters, which I don't have with me to show you, to remove the cord clamp before the baby goes home. However, if the stump is still a little bit wet, then the clamp is left on and it gets removed at the pediatrician's office. A title in white on a black background appears: cryos. An image of a stainless steel instrument called a cryo lies on a blue towel. Cryos are instruments that are primarily used to stop blood flow. And this instrument in my hand is about 5.5 inches long, and the handles are shaped like the finger holes on a pair of scissors. Can you hear that? That's the sound it makes when the ratchets shut together, and when the finger holes come together to close the instrument. The bottom of the instrument is slightly curved upward, and when you open the instrument, the curved jaw ends are serrated on the inside. On screen, there's a really good close-up image of the horizontal striations that are located on the inside ends of this cryo instrument. On a black background, a title appears: bandage scissors. A thick type of stainless steel scissors, akin to a regular pair of scissors, lies on a blue towel with its jaws opened. This pair of stainless steel bandage scissors is about 6 inches long, and these look and feel like regular scissors, but are definitely more heavy duty. Bandage scissors are designed to cut through tough materials such as dressings or clothing and not injure the patient. Interestingly, both the blades are slightly angled upward, unlike a normal pair of scissors, which are more straight edge. At the scissors end, the top blade is sharp and curves slightly upward, while the bottom blade is blunt, but it can cut through material quickly. And that blade is also curved upward to meet the top blade. Bandage scissors are the scissor of choice to cut a baby's umbilical cord. The umbilical cord doesn't have any nerve endings, so the baby doesn't feel pain when it's cut. The words 10 cc syringe with an 18 gauge needle appear in white on a black background. After the baby's umbilical cord is cut, the baby is handed off to the nurse or left on the mother's abdomen. And in either case, the nurse will do her initial assessments then. The next step is to collect the baby's cord blood. It's important to note that what I'm about to explain is not cord blood banking. That's a special process that would also be done during this step, in case the patient chooses to use or to collect the baby's blood for a special circumstance, such as a stem cell procedure in the future. And that's collected in a very specific way and arranged ahead of time with the physician. Okay, let's do a quick recap. As I explain the steps, I will hold up the previously mentioned instruments. After the baby's born, the doctor will suction the baby's nose and mouth. And then we'll apply the yellow cord clamp, apply the cryo clamp, and then cut with the bandage scissors to complete the separation. At this point, the cryo clamp, which is the only clamp that's left on the field, is opened, and that releases a flow of blood from the umbilical cord, which goes straight to the placenta basin. Remember that the placenta is still inside the mother at this point. Then the blood is immediately collected in this clear plastic 10 cc syringe. The black markings on the plastic indicate the dosing measurements in milliliters. The plunger is pulled back so that the blood fills inside of the syringe, and then the physician hands off the syringe to the nurse along with this 18-gauge hypodermic needle. The 18-gauge needle is identified by its pink-colored sheath to protect you from an exposed needle. The nurse then transfers that blood into a purple laboratory tube, which unfortunately I do not have here today. And that's correctly labeled with the patient's name and other personal identifiers, and then it's sent down to the lab for processing. You got all that? There's going to be a quiz later. If the blood collected isn't used within a specific amount of time, it's discarded by the lab. For mothers whose blood type is group O or of a negative blood type, the physician will order the baby's blood type to be tested. Some reasons for this include circumventing any blood type incompatibility for mama's future pregnancies, or to determine if there's an increased risk of jaundice to the newborn. A title in white appears against a black background, placenta basin. This placenta basin is about 12 inches by 9 and holds about 4 pounds or 2,000 milliliters of fluid. That's quite a bit, don't you think? This is made of white plastic, and this particular model actually has a lid, which is kind of nice. The placenta, which acts to nourish the baby during pregnancy, is no longer needed by the body after birth. And so the uterus will contract and act to detach the placenta from the mother's uterine wall. The mother will push it out naturally during a contraction, and then the physician or midwife will bring this placenta basin to the field to catch the organ. The physician or midwife will also take a closer look at the placenta to see if there's any anomalies. They also inspect the portion of the umbilical cord that was cut to ensure that there are 2 arteries and 1 vein present. And yes, there are people who actually take their placentas home. And some people will use them in their garden, which I personally think is kind of wonderful. However, we have had some patients that have told us that they were going to go home and make soup out of it. I'm making a yuck face right now. So let's move on. The words sponge sticks appear as a white title. Sponge sticks are very versatile instruments, and I happen to have a sponge stick right here. The stainless steel instrument is about 8 inches long. Like the cryo instrument we saw earlier, they also ratchet shut. They have finger holes that open and close the instruments. You'll get a closer look on screen. They're designed to hold small sponges in its serrated loop jaw ends. The ends are oval shaped, and so think of the ends as a donut hole opening within a hole. These are used to carefully help the placenta slide out of the vagina. However, in cesarean sections, they're often used to also close the uterus tissue shut or bring them together while the surgeon sutures the muscle shut. On a black background, a title in white, The Repair in Episiotomy. Next, the physician or midwife will examine the mother's perineal area to determine if suturing is needed or an episiotomy. So let's talk about that process first. But let's define what a perineum is. Both males and females have a perineum. For women, it's the area between the anus to the vaginal opening. And this is a very sensitive area that has a lot of nerve endings. On a black background, a title in white, ratex. These sponges are also called 4x4s because of their size. The healthcare provider will use these ratex to wipe the perineal area clean to take a closer look, and then they'll determine to see if a suturing is needed. I have an example of 2 ratex in my hand, and you'll note that these white gauze or 4x4 sponges have a wavy blue line stitched to the fabric. And sometimes the lines are wavy, and sometimes they're just plain Jane straight. And sometimes they're not a line at all, but like a fabric tag or a tail end. And here's an insider tip. Most surgical procedures are required to have radiological sponges used in their cases in case there's ever a question if a sponge was left inside the patient. That's the purpose of this wavy blue line. It's what'll show up on an x-ray if a sponge was left behind. The sponge stick instrument that I mentioned earlier can easily hold ratex in its jaws when it's folded neatly. And I thought I would just create a quick square for you so that you can see that. So I will take my ratex 4x4 sponge, fold it in half, and then fold it in half again. Then take the instrument, and I will place this now small square in the ratex sponge within the jaws of the sponge stick instrument and clamp it shut to hold it in place. Ta-da! That's why they call this a sponge stick. It's important to note that ratex also come in groups of 10. So if there's ever a package that doesn't contain 10, it's discarded and a new one is opened. It is vital that all sponges that go into a patient are counted and accounted for. What goes in must come out. A title in white appears, administering numbing medication. Let's talk about the repair. The episiotomy requires a couple things: a tissue forceps instrument, a needle holder, and a needle of choice, which we won't go into here because there's a variety of factors that affect choice, and a pair of suture scissors. And I'll show you all of those instruments here in a moment. Let's suppose that the new mom doesn't have an epidural on board, or that the anesthetic that she has during labor is already wearing off. She'll usually get an injection of lidocaine, which is a numbing medication, to numb the area before any suturing begins. The nurse will pour 1 fluid ounce of the clear lidocaine solution in a clear plastic medicine cup or even a small metal container. I don't have any of those here to show you today, but I still wanted to make mention of it. Medication is drawn up with a clear plastic 10 milliliter syringe called a Luer lock control syringe, which I have here in my hand. Used to administer the medication is a 21 gauge hypodermic needle, and it's covered by a black sheath to protect anyone from getting poked. Hot tip: most nursing staff can identify the gauge of the needle based on the sheath's color because they're pretty standard. The control syringe is made of a white, clear plastic and has 3 circular finger holds at the end. 1 finger hold is at the end of the plunger so that you can use your thumb to draw up and push the medication. Or you can use the 2 side finger holds as well for the same purpose. The black markings are used for dosing measurements. The words tissue forceps appears in white on a black background. I'm holding a pair of tissue forceps with teeth in my hand. This tissue forceps is quite long and not typical for a vaginal delivery. Those are about 6 inches long, but they look and feel like a pair of tweezers. Sometimes these stainless steel tissue forceps come with teeth, like the ones I have here, or can have smooth tips to pick up more delicate tissue. The image on screen gives you a closer look at the tips. They have small jutted teeth that face one another and interlock when the thumb and pointer finger pinch together. It's designed to hold tissue and suture needles firmly. In white letters, the words needle holder appears. Not all suture needles require a needle holder. It's true. That's because not all suture needles are curved. Did I pique your curiosity? But this 5-inch stainless steel needle holder, which I'm holding, ratchets when the finger holes come together. You'll see a close-up picture of the tips on screen. The instrument is open so that you can see the inside tips, which have tiny cross hatches for optimal needle gripping. The words suture scissors appears as a white title. Just what they sound like, these scissors are designed to cut suture. And I'm holding a 6-inch long pair of suture scissors in my hand. The tips are rounded at the end, but don't let that round tip fool you. These are sharp. Alice clamp is written in white letters on a black background. The purpose of this Alice clamp is to hold tissue together, mainly to secure it so that the ends are straight and come close together. And I have an example of that instrument here in my hand. This straight 5-inch instrument is mainly used in general surgery, but it's also used in labor and delivery too. It has finger rings and it ratchets. The picture on screen features the jaw's tips, which have small, sharp teeth and curve toward each other on the inside of the instrument. When I look closely at the grasper teeth, I kind of see miniature fists with the teeth that are like the knuckles showing. Pow, pow! But I'm also reminded of how grateful I am for anesthesia and for modern medicine. Vaginal packing is written in white letters on a black background. If a patient is bleeding heavily postpartum, the healthcare provider might insert something called vaginal packing. It just depends on the situation. And I have an example here to show you. But they would also administer medications to help stop the bleeding as well. Vaginal packing is a white, rectangular woven cotton gauze that's about 4 inches by 36. It's fairly long. And this blue tail or heavy tie that I have here in my hand at the end, it's not only just used to pull the vaginal packing, but it's also X-ray friendly. And I will say it again, it is so important that any sponge used for any purpose is removed from the patient and is accounted for. The nurse and doctor will also weigh bloody sponges on a scale to determine the amount of blood loss, and they document that. Finally on screen, I will show you a short video where you will see me actually do a vaginal delivery setup so that you kind of get a full picture. The camera will focus mainly on the table, and you won't see my face, but you will see navy blue scrubs moving about and my gloved hands arranging the items on the table. And at my hospital, the vaginal delivery tables are done in a room close by the nursery. Sandra, with only her body and navy blue scrubs seen on screen, walks towards a delivery table. As she moves, she gloves her hands. An open package of blue-colored drapes and vaginal delivery supplies sits on top of a blue sterile table cover. She unfolds 2 blue sterile towels covering the entire table. The leftover blue towels are placed next to the white plastic placenta basin, and removes the various gowns, drapes, and towels from inside the plastic basin. The basin is placed on the mid-upper quadrant of the table. Gowns and drapes are split up and go on opposite sides of the placenta basin. Next, the folded vaginal packing is placed near the sterile towels. The ratex are counted out and placed in 2 neat rows of 5 at the lower end quadrant of the table. The bulb syringe, yellow cord clamp, 10 cc Luer lock syringe, 21 gauge needle with the black sheath, and finally the 10 cc cord blood syringe, hypodermic 18 gauge needle with the pink sheath, are placed at the extreme opposite ends of the ratex. Next, Sandra brings a stringer full of sterile instruments onto the field and unlocks the stringer, releasing the instruments. The first instruments placed are 2 large cryos. The yellow cord clamp and the bulb syringe are placed in between the cryo instruments. Then 2 Alice clamps are placed by the ratex at the opposite end of the table. Since these don't get used often, the sponge stick instruments go smack dab in the middle of the table, near the cord blood syringe. The delivery of the placenta marks the near end of the vaginal delivery. Then the needle holder and the tissue forceps are placed in consecutive order by the ratex. The bandage scissors go near the yellow cord clamp. And finally, the suture scissors finds its place next to the tissue forceps in case suturing is needed. This completes the table setup. A sterile blue plastic drape is used to cover the entire table. A gray bucket filled with a variety of surgical hats, masks, and shoe covers goes on top of the outer drape for the physician. A white logo in script appears on a black background, Sandra Manwiller. A white line underlines her name. Below in block letters, the words voice actor, sandramanwiller.com.